This is Mahmoud Kiami from the Dean McGee Eye Institute, University of Oklahoma. I'd like to go over a couple of cases that hopefully will give some good insight into canaloplasty using the iTrack catheter. Specifically, the utility of pressurized volumetric circumferential viscodilation using the iTrack catheter. In the first case we're going to take a look at, I've already intubated canal and advanced about 3 clock hours and met a point of obstruction. Now typically when there's a point of obstruction, we viscodilate to try to get through. Here we've done the same thing, viscodilated at the point of the obstruction, and you can see distal to the point of obstruction, blanching of the episcleral vessels, which denotes viscodilation distal to the point of obstruction. Again, here's the point of obstruction, and here's the viscodilation and blanching of the vessels distal to obstruction. I was able to then pass the catheter through this point of obstruction, and upon asking the patient to look up, we realized that there was blanching of the episcleral vessels at least 6 clock hours distal from the original site of obstruction, simply by viscodilating at the site of obstruction. This truly speaks to the utility of pressurized viscodilation. Now we'll take a look at the second case. Here I've advanced 360 degrees, and now we're retracting and viscodilating. And what I really want to point out in this video is the fact that we have traced the viscoelastic with vision blue, and you can see as we are retracting the catheter and viscodilating, vision blue coming through the TM into the anterior chamber. Again, by dyeing the viscoelastic, we can clearly see that as we retract the catheter, viscodilation does not only have an effect on the distal collector channels, including Schlemm's canal, but also proximally on the trabecular meshwork. You can clearly see the viscoelastic pushing through the TM, working on the trabecular meshwork, as well as distal blanching through the collector channels. This also speaks to the utility of pressurized volumetric circumferential viscodilation and the fact that iTrack canaloplasty also works at the level of trabecular meshwork, not just Schlemm's canal and distal collector channels, but also on opening up trabecular meshwork.